Welcome to Holistic Wisdom Live. Today is part 2 of the series of breast implants risks and illness. This is my second guest in this series, a friend of mine who also became my client and my patient, Dr. Uhuru Smith. Thank you so much, Uhuru, for being here and for sharing your story.
Thank you for having me.
Yes, this is such an important topic. And, I started off the first episode talking about how in the last year, breast augmentation surgeries went up by 44%. And I find it fascinating because statistically, also last year in 2022, a black box warning came out saying that the breast implants are linked to squamous cell carcinoma as well as anaplastic large cell lymphoma and variety of all kinds of autoimmune disorders, right? Mystery illness, chronic conditions, heavy metal toxicity, candida, you name it. In fact, there is this social media Facebook group where I've been referring a lot of women who have come to me to that group. And what I find fascinating, because you and I never had this discussion, you were coming to me, it didn't even occur for me to ask you if you've ever had implants. And it wasn't until you had breast cancer, which we'll dive into. And then after that, I didn't see you, but I would say probably 3-4 months ago, you came to see me for something else. And I said, I hope you didn't put implants after the surgery. And you said, oh, this is the reason why I had cancer to begin with. I would not put them in. And I was like, oh my God, I had no idea.
Right.
And let's start with how long you've had your implants, and let's talk about some of the symptoms and things you've experienced over the years. And by the way, what kind of implants did you get?
So I should, especially being a physician, I should know all of these answers, but I actually don't know the exact type of implant. I had implants put in. I know they were silicone. They were not silicone. I believe they had a coating on them. One of the coatings that has been linked to either lymphoma or leukemia, but I'm not 100% sure. I had them put in the very early 2000s, probably around 2001, 2002. And the thing that I find the most interesting probably and was the most staggering is that not long after I had the implants in, maybe like within a year, I was having symptoms of an inflammatory reaction in the cancer affected breast. But again, there's no official link between the two, but I just find it interesting that I had this inflammatory reaction. I had redness, swelling, itching, pain. And I went to, at the time I was a medical student at Georgetown, I went to the breast center there in Georgetown, which of course is a very prestigious breast cancer center. I saw what was supposed to be the best, surgeon in the department. And her response was, well, let's image it, but, this is probably just kind of like a chronic inflammation that'll go away. We'll give you some anti-inflammatories, and sort of sent me on my way. I did get an MRI. The MRI showed no cancer, because of course, when we're doing breast imaging, that's what everyone's very concerned about is there breast cancer? It did not show any major tissue changes at that time. And so I just kind of lived with it. And I still can't believe, now that I'm so much older and wiser, the way in which we as women in particular, and myself included, even being a physician, that I just kind of accepted that this is the way it is, and I'm just going to live with it, when there was obviously something very wrong. So that's kind of the backstory of when I started first having problems and what type of implants I had.
So, and did that problem ever go away, or did it stay with you for years?
It pretty much stayed with me. It would ebb and flow, like I think many chronic inflammations, chronic inflammatory reactions. It would stay with me, and then it would come back, and it would sort of die down, and then it would come back. And I just really, as long as my MRIs and my mammograms were negative, I was, I just was kind of like, well, I guess this is just the price we pay for, big boobs. I don't know.
Mm. I wanted
Very-
to bring something up that I think is important. It says here, silicone gel breast implants were approved for the first time in November 2006. So you actually got them before they were approved. Did
yes.
you know that?
Yes, I did know that.
Wow.
And I had a clinical reason as to why the surgeon was allowed to use them in me at that time. I can't remember exactly the reason. I think it had to do with the type of um, tissue changes that I'd already had. I'd already had like um, fairly thin skin, and I had had a reduction before that. Actually, it wasn't a reduction, it was a lift. And so I'd already had like scar tissue and tissue changes. And so he was allowed to use the silicone for that reason.
Okay. Do you have any breast cancer in your family?
I do, interestingly enough. So my grandmother had breast cancer at age 40.
Mm.
She's since passed away. And of course, at that time, she would be about 100 right now. So at that time, 60 years ago, they didn't know, triple negative, ER positive, et cetera. So they did not tissue type her cancer at that time. I had genetic testing done. My genetic testing was negative.
Mhm.
But I think it's interesting that she had breast cancer and my mother had ovarian cancer.
Mm. Okay, so what led you to finally get the diagnosis of breast cancer when you were diagnosed? What year was it? 2020? No,
2018.
2018, right?
Yes.
Wow.
So interestingly enough, I found the tumor myself. And I can't begin to emphasize to people to self breast exam. I'd started getting mammograms at age probably 40, if not maybe even before that. I had one MRI done because of the breast pain that I was having. But at age 40, I had my first MRI and mammo as like a baseline because of my positive family history. Um, and I had a negative mammogram just barely a year and like 1 or 2 months prior to feeling the tumor myself. So I cannot begin to emphasize like self breast exams. I'm not sure somebody would have caught it on exam.
Mm.
There's so many issues in medicine now, and we can delve into those in another episode or sit over many bottles of wine and cheese to discuss those. But really the bottom line is that the best exam is done first of all barehanded without gloves, and the physicians, the nurse practitioners, the PAs that are doing exams, of course, for political reasons and liability reasons, no one's going to let them do breast exam without gloves on. So it affects your tactile sensation. So you doing an exam, a barehanded exam on yourself, is going to catch something that shouldn't be there sooner than many, many physicians would catch it. So in less than 14 months, I grew a cancer.
How large was it? Do you know?
It was, so in the initial imaging, it was 2.2 centimeters. And then once we went to surgery and I got pathology, it was, I believe, 1.7 centimeters. So I'm not sure why it was that much smaller. I know I was very, very strict with my diet. I dropped a lot of weight very quickly. I was
You were
eating,
meditating too, I remember.
I was getting IVs. I was eating only
Yes.
green vegetables and drinking water. So,
And shrinking.
I'm sure that I starved that cancer as much as I could before surgery.
Mm.
So I actually was able to downgrade my classification from stage 2 to a stage 1 after surgery.
Amazing. Now, was that cancer that you had linked in any way to the implants that you had?
Not officially, no.
Not
No.
officially.
Yeah, they don't actually know what causes triple negative breast cancer. Their risk factors, stress is probably the number one risk factor, obesity. There are some genetic factors that link it, but I don't believe that we know what causes triple negative breast cancer.
But the implants that you have, were they the ones that the black box warning has been issued for?
That I'm not 100% sure. I know they were silicone, and I believe they were coated. So I believe, I don't know for sure. I'd actually have to check with my surgeon. I'm not sure that she would be able to tell though, because frankly, the capsular contraction that I had was so severe that the implants, they would have had to send the implants to pathology. And I'm not sure if they did that or not, and probably remove all of the tissue around the implant because there was so much inflammatory capsule surrounding the implant.
So they took the capsule out. This is something I learned actually in the
Mhm.
previous episode when I interviewed Christine. She talked about that many surgeons don't remove the capsule, which I was surprised because it's so detail oriented. So they leave that in, and that's the part that has the toxins, the most toxins. And
No, they took it all out.
okay, that's
And
good.
probably partially because it was an oncoplastic reduction that I had. In addition to the removal of the tumor at the time, they took the implants and the tumor out at the same time. So they took all the surrounding tissue of the capsule out. So they call that actually an oncoplastic reduction with a partial mastectomy.
Okay. Wow. So it took years to get wiser, and it
I
took
know.
a crazy event to really begin to connect how important it is, right? To
Right.
treat our body well, and really, did you have any kind of thoughts about going back and seeing what were you like? What was your mindset like when you were younger, a medical school student, right? You were a medical school student or resident?
When I got the implants, I was in medical school. Yeah.
Medical school, right? So the mindset of the younger version of yourself and where you are today, if you go, did you go back and just think, where was I? Perhaps influences that impacted you. Was it more influence within yourself or your environment, people around you?
I think it was, I think it was the environment around me. I think as women in particular were constantly being bombarded with images of what we're supposed to look like and what's beautiful, what's attractive, and there's a lot of pressure to um, to blend into whatever is considered beautiful and attractive at the time. At that time, implants were they are now, but they are now as well, but implants were very, very popular. That was kind of the boom of implants.
Mm. And I find it fascinating because now, especially with social media, right? All the ways that women can edit their own photos, right? On
Right.
top of having all the plastic surgeries and injections done, it puts so much pressure on younger women, I would say, and younger girls. And when I saw the statistics that in 2021, 365,000 breast augmentations were performed, just it's unbelievable, how much it has gone up, even in the last couple of years. It sends a big message, right, of just women having these important conversations and surrounding yourself with women who you can be open with and also feel good being yourself without having to have the need or the pressure to adjust something physically to fit in.
Right. Right.
Mm.
Right.
Yeah. Would you say, was your husband supportive? Because I've also read in the previous episode, we've discussed how in this group online, there are many women who are afraid to do the surgeries because their spouses don't support, will not support the new look. Would you say that, I know Tracy, I'm
Yeah.
sure is such a supportive guy, but would you say, did he have any advice for you? And what did he say?
I'm very fortunate. I think that he's always supportive no matter what direction I would want to go. Um, so whether I wanted the implants or wanted them out, he was going to be supportive. But he's always been the person that says, listen to your body. If something's not right, you have to be your own best advocate. Make sure you're doing the things that you're doing because they're coming from a place of like inside a place of wholeness, a place of healing. I think that's the broader message that he's always given me. So I'm very grateful for that.
Yeah, it's beautiful. It's beautiful to have a partner in life who supports you and allows you to make a decision, but also gives you that beautiful container
Yeah.
to feel into yourself in a bigger way. So if you were to give advice to young women who are watching this and are thinking about going through with this kind of surgery, or perhaps women that have done it, what advice would you have for them?
I would say number one, self breast exam and take it very, very seriously, and do it regularly. And number two, I would say just don't do it. Just don't do it. Get rid of the implants. I feel better than I've ever felt um, since they're gone. Even after having had cancer, I feel better. The other thing that I noticed while I had the implants, and then of course after having surgery, is how it affected my range of motion in my arms and my shoulders and my upper thoracic spine. And now that I'm getting older and I realize, okay, wow, our generation is going to live to be, 90, 100, 110 years old. Are you really going to retire at age 65 and just not? What are you going to do for the next 30 years after you retire at age 65? There are things you're going to want to do. You're going to maybe want to play golf. You're going to want to play tennis. You're going to want to do yoga. Maybe you'll work part-time. And if your shoulders and your arms and your upper thoracic spine and your neck is not in good shape, you're going to have much bigger problems than what your breasts look like. And so those are things that I really didn't take into account on how putting these, foreign object that was kind of large that didn't belong there, how it was going to affect the rest of my body's health, in addition to the autoimmune and all those other things, the inflammatory. Say you had none of that, you're still going to get side effects in musculoskeletal as a result. So I would just say, don't do it. Figure out a way to learn how to be happy with yourself.
That's a great advice. Thank you so much for today. Thank you for sharing your story. I hope that it really goes deep with people who need to hear your message.
I hope so too. Thank you so much.
Thank you.